If you are new to me, my name's Carmen. I am a myofunctional therapist, and I have a very busy global myofunctional therapy practice. I like to say that I am your myofunctional educator extraordinaire because I am here all the time helping educate my community about all things myofunctional therapy. So in this little visit here, I am going to talk about how to tell if a client is progressing. It seems like this is an epidemic recently. I'm getting people who are coming to me for second and third opinions. Some of these people have been working with somebody else and they are extremely frustrated, as I can completely imagine, because they have no idea where they are, where they're going, or how they're doing. So I just want to talk about this real quick. I'm going to make it short and sweet. So myofunctional therapy is done for the rehabilitation of the oral structure. So it is done to improve function. It does not matter what appearance is like. It doesn't matter about all of that jazz. It only matters when you're talking about function. So I talk about this with my clients. Really, I seem to have two conversations. First is how am I going to know that I'm doing well? So I always share with my clients that it's about how you're progressing. Every single time we do something, I am always checking skills assessments, making sure that you are moving along. Now, with that said, many of you will ask a question as soon as you have a frenectomy and you will say, holy cow, I think maybe I didn't get a complete release, which is entirely possible because, as you know, I see people all over the world, so I don't always get to build my dream team. But when people ask me this, here's what I say. We're looking for function. So we're not worrying about the wound. We're not worrying about all that. We're going to see how your function is. So how I tell if my clients are progressing is it's that they're getting better. Their function is improving. Sometimes that is just the smallest incremental improvement. I have some clients that have to really work and work and work. And that's just because those muscles, the lights are on, but nobody's home. So they have to work really hard at it. So when I am seeing my clients, I am evaluating every time. I'm looking at skills assessments. I'm making sure that they are improving, that their function is improving. When that time comes that maybe they're not improving or they feel like suddenly they're not making any gains, then we talk about, okay, maybe this could be a situation where you do need to have an enhancement. Typically, for me and my clients, by about session 5, 6, or 7, I can make that judgment call on whether I feel like they need an enhancement or not. And when I say enhancement, I mean whether they need another procedure. And a lot of times people look at that like it's negative, and it totally isn't. It's not like a do-over. It's not like somebody didn't do something correctly. It's just that maybe they need a little bit more. I tell my clients all the time, especially those clients that have a severe restriction, that they might very well need a 2-part release, and that's okay. So they have a release, we do what we can, and then they have another one when they're not making improvements anymore. So that is one thing that is really important to consider. Are you still getting better? How's your therapist? When I work with somebody, I give you a step-by-step framework. That means from the very beginning, I have a plan for you. Now, it doesn't always go according to plan, trust me, because when I'm done working with my clients, there's lines drawn, there's X's, there's squiggles, there's all this stuff going on. But I start with a plan, and I know that I'm going to do this first, and then I'm going to do this, and then I'm going to do this, and then I'm going to do this. It makes sense. And what I'm seeing recently when I have all these people coming to me for second and third opinions is they're going to somebody for months and months and months, and they're not getting anywhere. And in my practice, it looks like they've done this. So it doesn't make a lot of sense to me, and I never want to step on anybody's toes professionally. So I tell my clients, I'm going to start you with a step-by-step framework, and we are always going to be evaluating to see how you're doing. In the event that my clients have to have an enhancement or a 2-stage release, whatever you want to call it, I have a plan. And that is something else that I find different from other clients who are coming to me after working with somebody else, is they don't really feel like there is a plan. And if you work with me, I really feel like I want you to know in the beginning that there is a plan, and then I want you to know that I have a plan if you have to have an enhancement. We stop, we pause, I tell you exactly what you should do. We don't miss a beat at all. So it's very important. So for those of you who may be in therapy or considering therapy, it's really important for you to ask the person you're considering, how do you know if I'm doing good? How do you know if I'm moving along? And how do you know if I need more therapy with you, if I need to consider a longer program, those type of things. Super important. I hope that helps, and I will see you next time. Bye for now.